So now here's where we're going to be able to get our best assessments for the hips and the pelvis. We're going to start with the hips. Now here certainly you could do all the foot stuff like dorsiflexion and plantar flexion, all that, right? Now, here's where your best practice with like supporting the leg. Now contour draping would be a factor here where you take the edge of the sheet, wrap it around, so you could create like a nice, bungee here. And you want to really get that reinforced, put the blanket on top of it, all that. So we want to put our forearm as close as possible to our elbow, right underneath the knee, support right at the foot, and then we can take that hip up. Now, what ideally I'd be watching for here and stabilizing, if I could, would be reaching across and stabilizing the other side of the pelvis, at least this side of the leg.
I'm short.
That's all problematic, and I'm used to, especially since we work at higher table heights, that's sometimes problematic. But I'm telling you, realistically, what you need to usually do is just watch what this leg does. So you're going to take the leg up, and barring the pants getting in the way, see how that leg starts to pick up? That's the end. There you go. Right there. Okay?
This was flat, you would see it come up.
And flat is another option certainly with this. It's like anything, this is giving you sometimes not the best read when you have that, but it's a bit just easier and protective because their knee's not at full extension. So it's not perfect, but this is where we can get some good rhythmic joint movement of the hip, right? If we need more accurate assessments, I would take the bolster out, and we would be everywhere from like the straight leg test. We'd take the bolster out, go ahead and take the bolster out. Straight leg test, you keep the leg straight. Support at the ankle. I feel like I'm just hugging the Achilles and then I'm behind the knee. And then you go up. And believe me, lifting a leg isn't always easy. That's pretty good. 90 degrees would be ideal, but look, this is pretty good. That's really good over there. Compare to the other side. Yeah, a little bit more here. Feels a little bit easier. Yeah. Good. Felt both reflective, felt resistance, felt tightness. There you go. So now you could leave the bolster out and do all this, and it would be more accurate. It admittedly is more accurate to leave the bolster out and then do these. So we're here, that'd be flexion, extension, right? Okay, I'm here, external rotation. We hold not below the ankle, we're gonna hold at the ankle, above the ankle, above the ankle. Okay, external rotation, internal rotation. Other ways I can look at internal and external rotation. Leg down, see we've changed the whole angle of the hip. This is where it can get kind of confusing. Both of these are rotation. That's internal rotation, external rotation. And you felt, for example, more symmetrical when we flexed you. When I flexed, this reads more uniform. I take the hip into extension and then do it. I mean, already laying here, the toes are pointed in. And there's more that way in here. There's nothing wrong with that. It just might be the thing that we would focus on, right? So you get to compare the two. Other ones we could do here are comparing leg length. Grab, you want your palms to be on the lateral malleolus. You're picking those ankles up, kind of hugging the Achilles. And then, get the legs more or less uniform if you can, all the way together, and then see if there's a leg length difference. If there's a side that bugs you, which one is it?
They both kind of do.
They do.
Just all the under
Okay.
their hip, but
Yeah, one hip more than the other, one side low back, or both kind of swap.
Yeah.
kind of both. It just depends.
Okay. So I have a case where,
This leg's longer.
yep. So if anybody were to come and do a quick look at over here at mine,
Oh, yeah. Okay.
see how we got a different length,
Mhm.
where where the heels are. If I just bring my fingers together, this one's further down, right?
Yeah. You could see it even before.
Mm-hmm. And I compare like where the patella is at. So interesting stuff.
You can see that the hip bone too.
That'd be the next. It's the next piece a little bit. I'm making sure I watch your time. So once we're here at the legs, we have other options too. I could take both legs like this. One leg, one hip is going
Just doing
into
that stretch.
abduction, abduction. One hip is going into adduction.
Mhm.
This way,
Because of what we're doing.
Mhm.
this way.
I just try to do those different stretches.
Now, this to start, if you were bothering to look at abduction, adduction, I mean, you're having to like drag their legs again across the table and all that. I mean, it's a thing. Try not to rotate them too much. Try to just, and see, you get a good gauge though. You look at where the line of their main torso is, thinking like belly button to chin, and see how far you can go. One and the other. And see if it's somewhat symmetrical. I'm like, eh.
I don't see this really that easy for
Yep.
you. With your longer legs.
There is, like even the book they're showing where you take one leg out, you get in between and you can go this way. As I was discussing with Sarah, I'm not the biggest fan of going through and like stretching the adductors, taking the hip into abduction. If there's hip issues, that's jamming the socket of the hip in a potentially awkward place. So if I see limited range of motion going into abduction, I very rarely have taken that as a reason to go into a stretch mechanic, and you can either pull like this, or we could go from the other side and push. I feel like it's a little bit less invasive to do a pull. I would tell you, mark that and use that as an excuse to work on their adductors more. Lengthen them with massage and compression, rather than taking that hip to end range. It'll be way easier on you, and if there's a hip related problem, it's much safer. Okay? All right, rotations, all that cool stuff. Do that. So you can see how hip in supine a little bit easier. I could go so far as to have a person go off the edge of the table, drop their leg, and we could do more stuff that way too. But for time's sake, let's punch along to the shoulders. Here, we're actually a little bit more limited compared to sideline, but it might seem a little bit easier to you because you're not fighting gravity as much. So, like rule of thumb, abduction, flexion. That one should make a lot of sense. That one's not. Rotation, internal rotation, external rotation. I feel like this is by far the best place to assess for shoulder rotation. Internal rotation, external rotation. Comparing from one side to the other. This is also a place where, of course, the elbow flexion is better here. The wrist stuff I think is better here. So for shoulders and arms, I tend to say scapula, some shoulder, sideline. Ball and socket, joint, shoulder, and the rest of the arm, supine. Including the hand, because you can just manipulate the fingers and the metacarpal is better here. I can test like, there's flexion, there's extension, metacarpals, individual fingers. Oh, thank you. Ulnar deviation, radial deviation. Okay. Thumb side is the radius. Radial deviation, ulnar deviation. Extension, flexion. And do it again. Thumb towards the bone, radial deviation, radius, ulnar deviation, pinky going towards the bone. Ulnar deviation, radial deviation, flexion, extension. Okay. Supination, supination, pronation.
It's a question. What's this?
Supination, pronation.
What's this?
Much easier all in supine. Some reasons why practitioners with clients will shift to supine being the first position. They can get more of the assessment stuff out of the way more easily. Rhythmic oscillation of the shoulder. I'm picking the tighter shoulder because I can see. This is a really easy assessment for you in this position because you can do this. If you can't already see which shoulder is more rolled forward, you can feel on top which one is higher up, but also look which one can you get your hand underneath more. I can get my hand underneath. You can look, this shoulder is up, and it's going to quickly show. This shoulder is higher. So either I can see it, I can just see the one's higher, can feel, oh yeah, this is rolled forward. There's also underneath. This one versus here, I can get underneath it more. So that means that's internally rotated and protracted.
So you can get under it more.
Then that's usually the problematic one. Feel like a big difference? No, she's more symmetrical. So here's some rhythmic stuff. If there's a shoulder thing, and I wanted to be careful,
I guess I know it's supinated. like
here's a
this,
nice,
But when it's.
I have to kind of hold the arm up in gravity because I'm picking the arm up off the table a little bit.
Here, it just seems.
And I'm just stabilizing the shoulder joint, just holding real good. If I'm sneaking my fingers, might be, you know, compressing pectoralis major a touch, and then just rhythmic oscillations.
It's going towards the inside.
And flexion of the elbow, extension of the elbow,
Inversion, yes.
And the other way is
flexion of the wrist,
Eversion.
extension of the wrist, radial deviation, little pop,
Weird wrist thing.
ulnar deviation. Has that been a thing? The other-
Yeah, both the joints like pop out.
They pop?
Yeah.
Yeah. Not like a dislocation feeling. They just pop
Yeah.
up. Yeah.
They've done it for a really long time.
Yeah, well.
I've gone to the doctor. They said nothing, so.
No.
I guess I'm getting the on.
Massage would be like anything where I would try to suggest is we'll see. But soft this,
Yeah.
all by itself. If done appropriately, you can't be radial or ulnar deviating. So you gotta be applying a soft fist like where you're protecting your wrist, and then you make sure you shift your body around in such a way where you're doing it appropriately.
Okay.
And as long as you do it right, then you're doing some isometric strengthening.
Gotcha. Okay.
But don't let yourself
Yeah.
do that,
Right.
right?
Just straight.
Yep. Remember, you kind of have an angle here, so it works pretty good. I mean, it's
Yeah.
yeah. There you go. Well, all that's left is really neck stuff. Here, my suggestion is take the pillow out, get it out of the way.
You just scoop.
Go ahead. Yeah. And then this isn't too bad because guess what? You can have them do the actions for you, and you're just there making contact to make it feel nice. I'm gonna say, okay, go ahead and turn to the right for me. Great. Turn to the left for me. Great. More to the left. So, not too complicated. If we were going to work here more precisely, Then there's the reaching underneath and using the claw to work. I'm trying to compress the right side of her neck. The way I would usually do this is get seated or down on a knee, so I can plant my forearm completely on the table, and then I'm just going to try to lift my fingers like this. That's how I would get a nice compression into the erector spinae and some other stuff related to the neck. And I could ask her to just slowly roll her neck around her head in a circle. Yep, real small. Small and slow. And let go, nice and easy. Cool, right? And then you just work your way wherever you feel like you need to. If you want to follow a pattern, you go as low as you can where you find C7. It's kind of the big bony knob. Now that's really low. Usually you're going to struggle to get your hand that low. But start low on the neck and work your way high. And make sure you're using the table to help support your elbow and forearm. But you are just the pressure, and you're using the weight of their head as you push your fingers up into the neck.
I don't feel them.
And then just slow little circles. Not feeling it much over there?
No, I was on my fingernails going into my neck.
Oh yeah, short fingernails. If you're ever gonna do any kind of finger, I tell you what, you gotta get them down. I know they look good, but I tell you what, you're gonna start stabbing people, and it's not gonna be your friend. So rotate. Yeah, seated, a chair. We can always grab chairs. Okay. And then after we would do this, then I could compare the rotation again. So I would do that on both sides. Ooh. Okay. So the left's not nearly as tight. But always balance them out. Do a little bit on both sides. Because yeah, there's the underlying asymmetry. That shoulder's up a little bit. This neck's a little bit tighter. The right, all right side.
Yeah.
So unroll your head a little bit.
This side.
Other direction. Good. Relax. Cool. Now, there's always neck flexion and stuff like that. But if I were to at least compare, okay, now we're going to turn to the right.
This muscle.
That looked easier. To the left. Okay.
Easier. Overall.
You can get to a point where you're more confident with the passive motions. But to start with neck rotation, when turning the neck, I just really strongly suggest have them do it. Okay? All right. Swip and swap.